So we've addressed movement and balance, and now when we go into that acute situation, so most of these what we've discussed so far is kind of like a prevention. It's just a daily way of life. But what happens when it goes into acute? And it does, because we have different taxes on us during our day. We've got things we have to do, carrying things on one side, maybe having to carry a child, and all this has a dysfunction. And it can add up. So when we get to these muscles in really kind of acute situation, we need to be able to release it. And one of the techniques is acupressure, just putting a little bit of pressure on those spots, just holding it in there as long as you can, and just release that muscle. And you actually feel how it melts underneath. It's quite satisfying for me doing it. Not so much for the subject, because
I think it's very satisfying for the subject to get that release, but
after,
not at the time.
Yes, because it can bring a tear to the eye.
Yeah.
But it is very, very, very satisfying for me to feel how those muscles actually go. And I think that's something that I would like to stress upon, is that it probably needs a little bit more pressure than people would like to apply themselves. There's another school of thought of light pressure. I think that is probably something that can be discussed, but I think in an acute situation, it takes longer for the light pressure to actually kick in, whereas the harder pressure will do it a little bit better.
How hard do you do it?
How do you classify pain pressure? That's kind of I don't know. It's a gut feeling.
The thing is,
what would you suggest?
I think as long as I have this philosophy is, if I'm going to apply pressure, whether it be to somebody or if I'm doing it to myself, I need to be able to still breathe through the movement.
Right.
I can be breathing out my mouth,
Yes.
exhaling, sure, no problem, to get rid of that energy. But I need to be able to breathe constantly in and out without holding tension. And I don't want to be producing tension in another area because this is so sore, I'm suddenly doing another strategy.
Absolutely. And the whole thing when I do the pressure is I direct their breathing.
So that's great because you're doing it, but then what do you do when they're doing it
Yes.
themselves?
Yeah, that's why the video.
Mm-hmm.